So, good day ma'am. I am Maple K. I'm a student nurse from Davao Doctors College. And for today's tutorial demonstration, I am going to demonstrate the cardiopulmonary resuscitation for newborn. So, in BLS or basic life support, CPR is important since it keeps the blood flow active, even partially extends the opportunity for a successful resuscitation. Also, it is an emergency life-saving procedure performed when the heart stops breathing. So let's start the procedure. First, evaluate newborn's transition to extrauterine life using Apgar score. This is to check if the newborn is needed for basic life support. So we have to look if the baby is blue and it has a irregular breathing. So let's check the baby. So next, check for the responsiveness by tapping the shoulder, rubbing the soles, and calling out name loudly. This is to check if the patient is conscious or unconscious. Also one of the assessment for responsiveness. So, baby, are you okay? Baby, are you okay? So, and we need to rub the feet of the baby, just like this. Baby, are you okay? Baby. Next, if there is no response, position the newborn on his back and call for the help to activate cold blue or the doctor's quick. So, this is to alert the medical professional because it is a life and death situation. So, we have to position the baby or the newborn. Just like this. So after that, open the airway and suction if necessary to check if the patient is conscious or unconscious. So also one of the assessment for responsiveness. So this is to allow the larynx of the baby to be elevated and grab some air. So just like this, and check the breathing of the baby. Then lift the chin of the baby. Okay. Next, check the positive pressure ventilation or the PPV using pediatric bug bulb mask or BVM. So, in integrated of apneic and bradycardic. So, first, attach the BVM to oxygen cylinder with 100% oxygen. Then, cover entire mouth and nose with BVM. This is to secure that the air will pass through directly into the trachea. So, allow 30 seconds of ventilation or 40 to 60 breaths per minute, and also look for the rise of the chest of the baby. This is to secure that the air that we are pumping is actually reaching the lungs so that the heart will function. So, next, have someone attached to cardiac monitor and pulse oximeter. This is for assistance and to promote efficiency to do high quality of CPR. And after that, do gentle chest compression if heart rate is still below 60 after 30 seconds of PPV. This is to put the right amount of pressure to the heart. So first, use either 2 to 3 fingers or 2-thumb technique when doing compressions, and place compression fingers at the center of the chest just below the nipple. Just like this. Next, press down approximately 1/3 the depth of the chest, about 1 and 1.5 inches. So, observe 3:1 compression to ventilation ratio, completing the 4 cycles in 2 man rescuer. So, let's assume that I have here my assistants. So, she gave the 2 rescue breaths. So, let's start giving the 4 cycle of compression and 2 rescue breaths. So let's assume that this is the oximeter. So let's put it into the tip finger of the baby. So I'm now starting giving the compression. 1, 2, 3. This is the rescue grip. 1, 2, 3. 1, 2, 3. 1, 2, 3. And after that, evaluate the heart rate after 4 cycles. If heart rate is still below 60, continue chest compression and at least in intubation and giving medicines. If heart rate is more than 100, we have to proceed to the next procedure. Then next, do the post-resuscitative care. This is to properly recover the patient after regaining conscious. So, I will remove the oximeter. Then, position the baby into the recovery position and just to flex her. Just like this. Then after that, document the time, procedure, assessment, responses to the treatment, and medication. Given this is to have the legal and baseline data. So I need to document all the information. So let's document. Now that I am done with my return demonstration, again, I am Mapple K. M. Mukamad from BSN 2, 12D of Group 35. Thank you!